My name is Christine Odding, and I am here to teach you about gastroesophageal reflux disease, also known as gastric reflux, heartburn, or GERD. GERD being an acronym for gastroesophageal reflux disease. Heartburn. What is GERD? According to the Adult Health Nursing 5th edition, GERD is the burning sensation that one experiences in their chest and their throat. What causes GERD? WebMD states that GERD is caused by the weakening of the lower esophageal sphincter. So what happens is when you eat, your food goes down your esophagus, passes through that LES, which immediately closes after it enters into the stomach. It then does not allow anything to go back up into your esophagus. So when your LES weakens, it does not close all the way, or it takes slower time to close. It then allows gastric juices to enter back up into your esophagus, and that causes the burning sensation. Complications of GERD. There are many complications, 4 of them being a peptic ulcer, hiatal hernia, Barrett's disease, and esophageal cancer being the most serious. A peptic ulcer. Peptic ulcer is also known as peptic ulcer disease. It is the most common ulcer of the area in the gastrointestinal tract that is usually acidic and thus extremely painful. It is defined as mucosal erosion equal to or greater than 0.5 centimeters. So this is what the ulcer looks like. Kind of looks like a cold sore, and that is on the inside of your stomach. So just imagine when you have a cold sore in your mouth and anything touches with salt or food and how it burns. Well, this constantly has your gastric juices on it, so it's always burning, and it can bleed. Hiatal hernia, or hiatus hernia. That is the protrusion of the upper part of the stomach into the thorax through a tear or weakness in the diaphragm. This can cause your stomach to become strangled and cut off blood supply. So over here is your normal, what it should look like. It's your stomach, your diaphragm, and then your esophagus. There's no protrusion. And then over here you have your hernia because your diaphragm wall became weak. So it then protrudes out. Barrett's esophagus. Barrett's esophagus refers to the abnormal change in the cells of the lower portion of the esophagus. When the normal squamous epithelium lining of the esophagus is replaced by goblet cells usually found lower in the gastrointestinal tract. Barrett's esophagus is diagnosed. The medical significance of Barrett's esophagus, it is strong associated with esophageal cancer. The main cause of Barrett's esophagus is thought to be the adaptation to chronic acid exposure from reflux esophagitis. So this is what your normal esophagus should look like, nice and pink, and then this is what happens when you have somebody who has constant reflux. That acid has just eroded the whole inside of the esophagus. That then causes cells that are not normally in your esophagus to travel up in there, and which can cause cancer. Esophageal cancer. It is a malignancy of the esophagus. Adenocarcinoma arises from glandular cells that are present at the junction of the esophagus and the stomach. Esophageal tumors usually lead to dysphagia, which is difficulty swallowing, pain, and other symptoms, and are diagnosed with a biopsy. This is actually going down into somebody's throat, and all those little white cells are parts of the cancer. You can see that it is kind of closed up their throat, so they have no difficulty swallowing. Diagnostic testing. The diagnostic testing to test for cancer or an ulcer is through an endoscope. You'd have an endoscopy done. The endoscopy goes through the scope with the camera at the end, as you can see, goes down their throat and down into their stomach. And then it allows the doctor to see anything that's down there, any polyps or sores. Symptoms that tell me I'm having heartburn: upset stomach, burning in their chest. Often people, older people, geriatric people, mistaken their heartburn as a heart attack because they have that burning in their chest and burning in the throat. What may cause my flare-up? Eating and then laying down immediately, eating spicy, fatty foods, acidic foods, smoking, even wearing tight clothes. Yeah, you're different. Peppermints, alcohol, soda. What can I do to stop the burning? You can eat healthy, take antacids, exercise, lose weight, and wait 30 minutes after eating before lying down. Medications that ease the pain. The most people take are antacids, which are meant to be used for mild cases of heartburn. They coat the stomach for a short amount of time that help reduce the amount of acid in the stomach. They do not reduce the inflammation in the esophagus. They are good for fast relief, such as Rolaids, Mylanta, or Tums. Second are oral suspensions. Oral suspensions are used to treat heartburn as well as nausea, diarrhea, and peptic ulcers. They coat the inside of the esophagus. This is also for fast relief and is only short-lived. It is such things as Pepto-Bismol. And there's anti-gas for people who experience bloating and stomach pains with GERD. These medications work for breaking up the gas bubbles, so such things as Gas-X or Beano. Then, more of the medications that you may have to see your doctor for, H2 receptor blockers. They used to only be available through a prescription, but now you can buy most of them over the counter. They work by shutting off the production of acid in the stomach. They are meant for mild reflux. So there are Zantac, Pepcid, Tegament, and Axid AR. PPIs are proton pump inhibitor. They block acid production and help in healing the esophagus. These medications are meant for severe heartburn and usually require a prescription. 2007 Mosby's Nursing Drug Reference says that Nexium, Protonix, Prilosec, or the generic omeprazole, Acifex, and Prevacid are all PPIs, or proton pump inhibitors. In conclusion, if you experience frequent heartburn, take antacids for fast relief, consult with your physician to discuss what the best options would be for your treatment. Fill your prescription, take your medication regularly. Continue seeing your doctor to make sure something that seems so simple as heartburn does not turn into something so severe as cancer. Just test your knowledge. What does GERD stand for? Anybody? It's gastroesophageal reflux disease. Name a few things that cause the painful burning.
Smoking. Daddy.
Smoking, acidic foods, oranges, pineapples, spicy foods, hot wings, pepper, Mexican food, alcohol, foods high in fat and sugar. Basically everything. What can stop the burning?
Medication.
Being healthy and eating well, and medicine. And what should you do when you experience frequent heartburn?
Go to a doctor.
Call your physician, consult with your physician, and get a prescription.